Hey guys, Don here. Welcome to the $1 Million Minute, where I want to go over kind of what I've been thinking about and helping people with and kind of working on in my own practice. First of all, I was talking to a doctor, and this is a doctor that he has an associate, and the doctor is going to be wanting some time off there. They kind of gave the stipulations, and this is what we find a lot of times now with this new generation, right? So they want 6 to 8 weeks of maternity or paternity, and then they want 1 day off a week to be with the child, and then they still want to make $150,000. And what I kind of said to him, I said, you can give them whatever salary that you want, but I think objectively it should be based on production. So he does a model where it's 35%, and then he kind of cuts out the high cost things. We do a model that's 30%, and you don't really cut anything out, and I think that's fair. That's what a lot of the big groups do. And so that's kind of what I recommended for him. I think if people come with asking for a lot of things just to stay, it's going to be more like charity than anything. So that was kind of top of mind. Another thing is we currently have a focused and a radial shockwave from Curemetics. And one of my partners here, they wanted us to test out the softwave. So now we have two focused, which I consider softwave a focus. I'll tell you as we start kind of playing around with that if it's similar to the focused Curemetics device. That's something that we're going to be putting in our other office as kind of an adjunct as a test. And then finally, I have a good word. I don't know if you have this, but a lot of patients, they bring in CDs and they say, hey, could you look at my CDs? And I look at them and I say, how many of your computers at home have CD-ROMs? And like none of mine do. We have an old, kind of an archaic computer that we use to pull up the CD-ROMs, and usually we can't even pull anything up. So that's my new phrase. So we just get new X-rays for those ones. Okay. So this day that I'm talking about is going to be a day that I saw 37 patients. Half the day was routine. And so there wasn't really much to say, except I have, which kind of throw my day off, was a diabetic foot that got infected. This was a patient that I've been kind of nursing along an ulcer on the plantar first med head, and he's trying to get back. He has a Charcot on that foot as well. He's trying to get back into a Crow boot. An Arizona AFO that's made by a podorthist. The problem is it hits too much on the first med head, and he had to have it redone, and he ulcerated, and then he re-ulcerated again with the blood and things like that. So I had to send him to the ED because of the cellulitis. So that kind of threw the through the day off. But in my paperwork here, I have a call to call him to see kind of how he's doing. Had a couple of other just nail care patients that had office visits. One was due to giving them ketoconazole, so that would be a level 4 because of medication management. Another one that wanted a nail sample, that was a level 3 just because of the nail sample, and we're going to go over that. One with venous stasis, and then another one with an ulcer that was healed. So those are the office visits for the morning. For the afternoon, there was a patient that came in for a porokeratoma. She had come back kind of a year later, and I did lesion destruction on that with salicylic acid, and we talked about offloading with a orthotic, but for right now, we're just going to do the porokeratoma with a lesion destruction. Another Swift number 4 on this patient, so I usually do 4 Swifts, and then I do a 3-month follow-up, so he'll be back in 3 months to see how he's doing. Another patient that came in for a matrix follow-up, which is a low level. I'm tending to double book those, or that's in my mind. I just always forget to do that for staff, but they're real quick visits. EPAT number 1 for metatarsalgia, second metatarsal. Another patient that came in for shin splints, and I did x-rays, and I talked to them about possibly doing a CHOPAT splint and then an EPAT in the future if it's not getting better. Another patient came in for Q-tenza. This patient has had a couple of Q-tenzas. I think it's number 5 right now. She is doing well. She's liking the results, so we're going to keep doing those. And we always get those verified by one of our wonderful staff named Diane. She verifies all those for our patients, which takes a lot of time. It's almost like a part-time job to verify Q-tenza. You would think that the company would do it for us, but we're using our own staff power. But for now, it's going okay. There was another new patient that came in. She had kind of some bunions, and she was concerned about some non-surgical methods. So we did toe spacers, just a single toe spacer, and then anatomic shoes. I usually recommend just the single, between the first and second toe spacer initially with anatomic shoes. If that doesn't work, then we can go to the correct toes, which I have here as well. And this patient didn't really want an X-ray. And she also had some kissing corns between the first and second toe. So I did talk, like if it's only that, I think anatomic shoes in the single spacer is enough. If not, we talked about doing like an exostectomy for that patient. And then another patient just came in for an ingrown toenail. Another patient came in for nails, and they had a hammer toe, so we talked about surgery. This was a patient that's kind of an older patient that just has a really painful, kind of a rigid hammer toe that's causing them pain at the tip because of the painful callus. And this is one that it's kind of semi-rigid, so I considered either doing like an 18 gauge with a flexor tenotomy in the office, or even thinking about doing an arthroplasty. And I'm trying to get the courage up to do an arthroplasty in the office. I tend to do only exostectomies. I haven't really done arthroplasties, but these days it just seems kind of a waste to go to the hospital for that because of just the time that it takes for one single hammer toe. Other patient came in. This was a little girl. She was 9-year-old. She had a really high cavus foot and a lot of equinus, so we worked on foam rolling for her, kind of a morning stretch, and then I gave her a pediatric pair of orthotics. They really weren't contoured high enough, but I didn't want to go custom right away. But I think just the loosening might be enough for her. And then finally, there was a patient that was here for kind of a Lamisil follow-up, and she got the booster. Anyway, that's the day, and if you have any thoughts, or if you want to tell me things that are working for you, I'll include it in one of the future $1 Million Minutes. Okay, thanks, bye.